Hey, Alpha Nurses, I'm Sandra from alphanursguide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A successful real estate agent brought to the clinic after being arrested for harassing and stalking his ex-wife denies any other symptoms or problems except anger about being arrested. The ex-wife reports to the police. He is fine except for this irrational belief that we will remarry. When collaborating with a healthcare provider about a plan of care, which of the following will be most effective for the client at this time? 1. A prescription for olanzapine 10 milligrams daily. 2. A joint session with the client and his ex-wife. 3. A prescription for fluoxetine 20 milligrams every morning. 4. Referral to an outpatient therapist. The correct answer is 4. Follow-up counseling is appropriate because of the client's anger and inappropriate behaviors. The goal is to help the client deal with the end of his marriage. A joint session might have been useful before the divorce and arrest, but not after. The client is exhibiting no signs or symptoms of schizophrenia or psychosis, so olanzapine is not indicated. The client is not exhibiting signs of depression, so fluoxetine is not indicated. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. A newly admitted client with an acute exacerbation of psychotic symptoms of chronic undifferentiated schizophrenia is having trouble deciding whether to live in a group home or a supervised apartment. When caring for this client, which of the following activities is most appropriate for the nurse to ask the client to do initially? 1. List the pros and cons of each housing option. 2. Choose between apple and orange juice for breakfast. 3. Identify why the client cannot live in an unsupervised apartment. 4. Decide which staff member the client would like to have today. The correct answer is 2. The client is in an acute psychotic state and cannot process complex decisions or explain complex situations. Therefore, the nurse would focus on decision making involving simple choices, listing the pros and cons of each housing option, and identifying why the client cannot live in an unsupervised apartment involve complex decision-making skills. Deciding which staff member to have today is a difficult and threatening decision for a client who is psychotic. As the nurse enters a room of a newly admitted prima gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. The nurse should do which in order of priority from first to last? 1. Call for immediate assistance. 2. Turn the client to her side. 3. Assess for ruptured membranes. 4. Maintain airway. The correct order is 1, 3, 2, and 4. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. Next, the nurse should turn the client to her side and then maintain the airway by keeping the neck hyperextended. When the seizure is over, the nurse should assess the client for ruptured membranes and the fetal status. A client in sickle cell crisis has been hospitalized during her pregnancy. After giving discharge instructions, the nurse determines the client needs further teaching when she states which of the following? 1. I will need more frequent appointments during the remainder of the pregnancy. 2. Signs of any type of infection must be reported immediately. 3. At the earliest signs of crisis, I need to seek treatment. 4. I have this disease because I don't eat enough food with iron. The correct answer is 4. Sickle cell disease is an autosomal recessive disorder requiring both parents to have a sickle cell trait to pass the disease to a child. Deoxygenated hemoglobin cells assume a sickle shape and obstruct tissues. Tissue obstruction causes hypoxia to the area and results in pain, called sickle cell crisis. This type of anemia is an inherited disorder. It is not caused by lack of iron in the diet. Self-monitoring for any type of infections or sickle cell crisis, an increased frequency of antenatal care visits are part of the teaching plan of care. A multigravida client thought to be at 14 weeks gestation reports that she is experiencing such severe morning sickness that she has not been able to keep anything down for a week. The nurse should assess for signs and symptoms of which of the following: 1. Hypercalcemia. 2. Hypobilirubinemia. 3. Hypokalemia. 4. Hyperglycemia. The correct answer is 3. Gastrointestinal secretion losses from excessive vomiting, diarrhea, and excessive perspiration can result in hypokalemia, hyponatremia, decreased chloride levels, metabolic alkalosis, and eventual acidosis if precautionary measures are not taken. Ketones may be present in the urine. Dehydration can lead to poor maternal and fetal outcomes. Persistent vomiting can lead to hypocalcemia, not hypercalcemia. Hyperbilirubinemia, not hypobilirubinemia, is typical in clients with hyperemesis. Persistent vomiting may affect liver function and subsequently the excretion of bilirubin from the body. Hypoglycemia, not hyperglycemia, may occur as a result of decreased intake of food and fluids, decreased metabolism of nutrients, and excessive vomiting. After doing well for a period of time, a child with leukemia develops an overwhelming infection. The child's death is imminent. Which of the following statements offers the nurse the best guide in making plans to assist the parents in dealing with their child's imminent death? 1. Knowing that the prognosis is poor helps prepare relatives for the death of children. 2. Relatives are especially grieved when a child does well at first but then declines rapidly. 3. Trust in healthcare personnel is most often destroyed by a death that is considered untimely. 4. It is more difficult for relatives to accept the death of an older child than that of a toddler. The correct answer is 2. It has been found that parents are more grieved when optimism is followed by defeat. The nurse should recognize this when planning various ways to help the parents of a dying child. It is not necessarily true that knowing about a poor prognosis for years helps prepare parents for a child's death. Death is still a shock when it occurs. Trust in healthcare personnel is not necessarily destroyed when a death is untimely if the family views the personnel as having done all that was possible. It is not more difficult for parents to accept the death of an older child than that of a younger child. When assessing a client with chest trauma, the nurse notes that the client is taking small breaths at first, then bigger breaths, then a couple of small breaths, then 10 to 20 seconds of no breaths. The nurse should chart the breathing pattern as 1. Cheyne-Stokes respiration. 2. Hyperventilation. 3. Obstructive sleep apnea. 4. Beale's respiration. The correct answer is 1. Cheyne-Stokes respiration is defined as a regular cycle that starts with normal breaths, which increase and then decrease followed by a period of apnea. It can be related to heart failure or a dysfunction of the respiratory center of the brain. Hyperventilation is the increased rate and depth of respirations. Obstructive sleep apnea is recurring episodes of upper airway obstruction and reduced ventilation. Beale's respiration, also known as cluster breathing, is periods of normal respirations followed by varying periods of apnea. A young adult is admitted to the emergency department after an automobile accident. The client has severe pain in the right chest where there was an impact on the steering wheel. Which is the primary client goal at this time? 1. Reduce the client's anxiety. 2. Maintain adequate oxygenation. 3. Decrease chest pain. 4. Maintain adequate circulating volume. The correct answer is 2. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is a priority for the client. Decreasing the client's anxiety is related to maintaining effective respirations and oxygenation. Although pain is distressing to the client and can increase anxiety and decrease respiratory effectiveness, pain control is secondary to maintaining oxygenation. Maintaining adequate circulatory volume is also secondary to maintaining adequate oxygenation. When teaching a client to deep breathe effectively after a lobectomy, the nurse should instruct the client to do which of the following? 1. Contract the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds, then exhale. 2. Contract the abdominal muscles. Take a deep breath through the mouth and exhale slowly as if trying to blow out a candle. 3. Relax the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds. 4. Relax the abdominal muscles. Take a deep breath through the mouth and exhale slowly over 10 seconds. The correct answer is 1. The recommended procedure for teaching clients post-operatively to deep breathe includes contracting the abdominal muscles and taking a slow, deep breath through the nose. This breath is held 3 to 5 seconds, which facilitates alveolar ventilation by improving the inspiratory phase of ventilation. Exhaling slowly as if trying to blow out a candle is a technique used in pursed lip breathing to facilitate exhalation in clients with chronic obstructive pulmonary disease. It is recommended that the abdominal muscles be contracted, not relaxed, to promote deep breathing. The client should breathe through the nose. A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available. A 22-year-old client is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago, his girlfriend broke off their engagement and canceled the wedding. Given the Diagnostic and Statistical Manual of Mental Disorders criteria for this disorder, the nurse should expect to find which data during the interview with the client. 1. Current treatment for pneumonia. 2. Regular use of alcohol or marijuana. 3. Evidence of delusions or hallucinations. 4. A history of chronic depression. The correct answer is 3. According to the criteria of the Diagnostic and Statistical Manual of Mental Disorders, a diagnosis of brief psychotic disorder is made when the client exhibits delusions, hallucinations, and disorganized speech or behaviors in the absence of a mood disorder, substance-induced disorder, or general medical condition. A client diagnosed with undifferentiated schizophrenia is being discharged on aripiprazole 5 milligrams every night. When developing the teaching plan about the most common adverse effects, which of the following should the nurse include? Select all that apply. 1. Headaches that will subside in a few weeks. 2. Transient mild anxiety. 3. Insomnia. 4. Torticollis. 5. Pill rolling movements. The correct answers are 1, 2, and 3. Headaches, transient anxiety, and insomnia are the most common adverse effects of aripiprazole. Torticollis and pill rolling are more common with the older antipsychotics. A client with pregnancy-induced hypertension is to receive magnesium sulfate to run at 3 grams per hour with normal saline to maintain the total IV rate at 125 milliliters per hour. The nurse giving the end of shift report stated that the client's blood pressures have been elevated during the night. The oncoming nurse checked the client and found magnesium sulfate running at 2 grams per hour. Identify the nursing actions to be taken from first to last. 1. Notify the primary healthcare provider of the incident. 2. Assess the client's current status. 3. Correct the IV rates. 4. Initiate an incident report. The correct answer order is 3, 2, 1, and 4. The nurse should first change the IV magnesium sulfate and normal saline infusion rates, and then assess the current status of the client. The nurse should then notify the primary healthcare provider to explain the error and report the action taken. A medication error has occurred, and the nurse will need to initiate an incident report. The nurse notices that a client who has just given birth is short of breath, ashen in color, and begins to cough. She becomes limp on the birthing table. At last assessment half hour ago, her temperature was 98 degrees Fahrenheit, pulse 78 beats per minute, Respiration 16 breaths per minute. Determine the nursing actions in the order they should occur. 1. Open airway using head, tilt, chin, lift. 2. Ask staff to activate emergency response system. 3. Establish unresponsiveness. 4. Give 2 breaths. 5. Begin compressions. The correct order is 3, 2, 5, 1, and 4. The client's actions indicate distress, and the nurse should initiate emergency procedures. The nurse should first establish unresponsiveness and then ask staff to activate the emergency response system. Next, the nurse should follow CABs of CPR. The nurse should check the pulse and begin CPR. Then after 30 compressions, a nurse should assure the open airway and give 2 breaths. After instruction of a prima gravida client at 8 weeks gestation about measures to overcome early morning nausea and vomiting, which of the following client statements indicates the need for additional teaching? 1. I'll eat dry crackers or toast before rising in the morning. 2. I'll drink adequate fluids separate from my meals or snacks. 3. I'll eat 2 large meals daily with frequent protein snacks. 4. I'll snack on a small amount of carbohydrates throughout the day. The correct answer is 3. The client needs further instructions when she says she should eat 2 meals a day with frequent protein snacks to decrease nausea and vomiting. The client should eat more frequent, smaller meals with frequent carbohydrate snacks to decrease nausea and vomiting. Eating dry crackers or toast before arising, consuming fluids separately from meals, and avoiding greasy or spicy foods may also help to decrease nausea and vomiting. The nurse and parents are planning for the discharge of a child with leukemia who is receiving dactinomycin and vincristine. The nurse should teach the parents to 1. Encourage increased fluid intake. 2. Keep the child out of the sun. 3. Monitor the child's heart rate. 4. Observe the child for drowsiness. The correct answer is 1. Dactinomycin and vincristine both cause nausea and vomiting. Oral fluids are encouraged, and antiemetics are given to prevent dehydration. Avoiding sun exposure is not necessary because photosensitivity is not associated with these drugs. Heart rate changes and drowsiness also are not associated with either of these 2 drugs. A client is undergoing a thoracentesis. The nurse should monitor the client during and immediately after the procedure for which of the following? Select all that apply. 1. Pneumothorax. 2. Subcutaneous emphysema. 3. Tension pneumothorax. 4. Pulmonary edema. 5. Infection. The correct answers are 1, 2, 3, 4. Following a thoracentesis, the nurse should assess the client for possible complications of procedure, such as pneumothorax, tension pneumothorax, and subcutaneous emphysema, which can occur because of the needle entering the chest cavity. Pulmonary edema could occur if a large volume was aspirated, causing a significant mediastinal shift. Although infection is a possible complication, signs of infection will not be evident immediately after the procedure. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per milliliter. How many milliliters should the nurse administer? Round to 1 decimal point. Blank ml. The correct answer is 0.7 milliliters. The formula is 10 milligrams over X ml multiplied by 15 milligrams over 1 milliliter. You cross multiply, and you get 15x equal to 10. You divide by 15 on both sides. X equal to 0.666, and then you round to 0.7 milliliters. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. Potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. A client admitted with a diagnosis of schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, and olanzapine prescribed has had an increase in manic symptoms in the past week. The psychiatrist prescribes a valproic acid blood level to be drawn at once. The nurse understands the rationale for this prescription, as which of the following? 1. All clients taking valproic acid need periodic valproic acid levels drawn. 2. Fluoxetine can decrease the effectiveness of the valproic acid. 3. A decrease in the level of valproic acid could explain the increase in manic symptoms. 4. The valproic acid level is needed before a short course of lorazepam for agitation can be prescribed. The correct answer is 3. Valproic acid is commonly used to treat manic symptoms. Therefore, a decrease in the valproic acid level could explain the increase in manic symptoms. Periodic determinations of the valproic acid level are necessary to determine the effectiveness of the drug. However, the stat nature of the specimen to be drawn indicates an immediate problem. Fluoxetine is not known to decrease the effectiveness of valproic acid. The valproic acid level is not needed before beginning a short course of therapy with lorazepam. The plan of care for an outpatient client with chronic undifferentiated schizophrenia includes risperidone therapy. The nurse prepares to administer this drug based on the understanding of which of the following? 1. The positive symptoms of CUS are usually more prominent than the negative symptoms. 2. Agranulocytosis is less of a risk with risperidone therapy than with clozapine. 3. Traditional antipsychotics help with negative symptoms, but not as well as Risperdal does. 4. Risperidone is less expensive than traditional antipsychotics. The correct answer is 2. With CUS, negative symptoms are more prominent. Therefore, risperidone is given to help control negative symptoms. Negative symptoms do not respond to traditional antipsychotics, such as Haldol or Thorazine. Agranulocytosis is commonly associated with clozapine. Because it is a newer drug, risperidone usually is more expensive than traditional antipsychotics. The nurse is planning care for a group of pregnant clients. Which of the following clients should be referred to a healthcare provider immediately? 1. A woman who is at 10 weeks gestation, is having nausea and vomiting, and has +1 ketones in her urine. 2. A woman who is at 37 weeks gestation and has insulin-dependent diabetes, experiencing 2 to 3 hyperglycemic episodes weekly. 3. A woman at 32 weeks gestation and is preeclamptic with +3 proteinuria. 4. A woman at 15 weeks gestation who reports she has not felt fetal movement. The correct answer is 3. The nurse should refer the preeclamptic client with 3+ proteinuria to a healthcare provider. The 3+ urine is significant, indicating there is much protein circulating. The woman who is 37 weeks gestation with insulin-dependent diabetes who has experienced hypoglycemic episodes in the past week can be managed with food and glucose tablets until the client can obtain an appointment with the care provider. The client at 10 weeks gestation with nausea and vomiting and +1 ketones should also be seen by a healthcare provider. But at this point, this client is uncomfortable, but her life is not in danger. The 15-week client would not be expected to feel her baby move as soon in the pregnancy, and this would not be considered a problem that requires immediate referral to a healthcare provider. The nurse is working with 4 clients on the obstetrical unit. Which client will be the highest priority for a cesarean section? 1. Client at 40 weeks gestation, whose fetus weighs 8 pounds by ultrasound estimate. 2. Client at 37 weeks gestation with fetus in right occiput posterior position. 3. Client at 32 weeks gestation with fetus in breech position. 4. Client at 38 weeks gestation with active herpes lesions. The correct answer is 4. Herpes simplex virus can be transmitted to the infant during a vaginal birth. The neonatal effects of herpes are severe enough that a cesarean birth is warranted if active lesions, primary or secondary, are present. A client with a primary infection during pregnancy sheds the virus for up to 3 months after the lesion has healed. The client carrying an infant weighing 8 pounds will be given a trial of labor before cesarean. The client with a fetus in the right occiput posterior position will have a slow labor with increased back pain, but can give birth vaginally. The fetus in the breech position still has many weeks to change positions before being at term. At 7 months gestation, the breech position is not a concern. The nurse is preparing to administer furosemide, Lasix, to a 3-year-old with a heart defect. The nurse verifies the child's identity by checking the armband and 1. Asking the child to state her name. 2. Checking the room number. 3. Asking the child to tell her birth date. 4. Asking the parent the child's name. The correct answer is 4. Safety standards require the use of 2 identifiers prior to medication administration. A parent can be used as the second identifier. Many young children will only answer to a nickname that does not coincide with a medical identification band, or may answer to any name. It is common for children on a pediatric floor to go into each other's rooms. A small child may not know their birth date. After teaching a child with leukemia scheduled for a bone marrow aspiration about the procedure, the nurse determines that the teaching has been successful when the child identifies which of the following as the site for the aspiration. 1. Right lateral side of the right wrist. 2. Middle of the chest. 3. Distal end of the thigh. 4. Back of the hip bone. The correct answer is 4. Although bone marrow specimens may be obtained from various sites, the most commonly used site in children is the posterior iliac crest, the back of the hip bone. This area is close to the body's surface but removed from vital organs. The area is large, so specimens can easily be obtained. For infants, the proximal tibia and the posterior iliac crest are used. The middle of the chest or sternum is the usual site for bone marrow aspiration in an adult. The wrist, chest, and thigh are not sites from which to obtain bone marrow specimens. The physician has inserted a chest tube in a client with a pneumothorax. The nurse should evaluate the effectiveness of the chest tube. 1. For administration of oxygen. 2. To promote formation of lung scar tissue. 3. To insert antibiotics into the pleural space. 4. To remove air and fluid. The correct answer is 4. A chest tube is inserted to re-expand the lung and remove air and fluid. Oxygen is not administered through a chest tube. Chest tubes are not inserted to promote scar tissue formation. Antibiotics are not used to treat a pneumothorax. A nurse should interpret which of the following as an early sign of a tension pneumothorax in a client with chest trauma. 1. Diminished bilateral breath sounds. 2. Muffled heart sounds. 3. Respiratory distress. 4. Tracheal deviation. The correct answer is 3. Respiratory distress or arrest is a universal finding of a tension pneumothorax. Unilateral, diminished, or absent breath sounds is a common finding. Tracheal deviation is an inconsistent and late finding. Muffled heart sounds are suggestive of pericardial tamponade. Following a thoracotomy, the client has severe pain. Which of the following strategies for pain management will be most effective for this client? 1. Repositioning the client immediately after administering pain medication. 2. Reassessing the client 30 minutes after administering pain medication. 3. Verbally reassuring the client after administering pain medication. 4. Readjusting the pain medication dosage as needed according to the client's condition. The correct answer is 2. It is essential that the nurse evaluate the effects of pain medication after the medication has had time to act. Reassessment is necessary to determine the effectiveness of the pain management plan. Although it is prudent to check for discomfort-related positioning when assessing the client's pain, repositioning the client immediately after administering pain medication is not necessary. Verbally reassuring the client after administering pain medication may be useful to help instill confidence in the treatment plan. However, it is not as important as evaluating the effectiveness of the medication. Readjusting the pain medication dosage as needed according to the client's condition is essential, but the effectiveness of the medication must be evaluated first. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about the situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself, and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. A client with undifferentiated schizophrenia tells a nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family, to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning, and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who is preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. 4. A client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy? The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asked the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy. The nurse is transferring a child who has had open heart surgery from the intensive care unit to the pediatric unit. The child's blood pressure has been fluctuating, but has been stable during the last 2 hours. The nurse from the pediatric intensive care unit should include which of the following information in the report to the nurse on the pediatric unit? Select all that apply. 1. Medications being used. 2. Current vital signs. 3. Potential for blood pressure to drop. 4. Drip rate for the intravenous infusion. 5. Time of the most recent dose of pain medication. 6. Medications given during surgery. The correct answers are 1, 2, 3, 4, and 5. The report made when nurses are handing off a client from one nursing unit to another must include information about the condition of client, potential for changes in client's condition, current medications, and care and services received. It is not necessary to know what medications were given in surgery to provide safe care at this point. Which of the following medication prescriptions to help relieve discomfort in a child with leukemia should the nurse question? 1. Hydromorphone. 2. Acetaminophen with codeine. 3. Ibuprofen. 4. Acetaminophen with hydrocodone. The correct answer is 3. Ibuprofen prolongs bleeding time and is contraindicated in clients with leukemia. Non-narcotic drugs other than ibuprofen or aspirin, such as acetaminophen, may be prescribed to control pain and may be used in combination with codeine or hydrocodone if pain is more severe. Hydromorphone may also be used for severe pain. A client has been in an automobile accident and the nurse is assessing the client for possible pneumothorax. The nurse should assess the client for 1. Sudden sharp chest pain. 2. Wheezing breath sounds over affected side. 3. Hemoptysis. 4. Cyanosis. The correct answer is 1. Pneumothorax signs and symptoms include sudden, sharp chest pain, tachypnea, and tachycardia. Other signs and symptoms include diminished or absent breath sounds over the affected lung, anxiety, and restlessness. Breath sounds are diminished or absent over the affected side. Hemoptysis and cyanosis are not typically present with a moderate pneumothorax. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. Petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from the trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. A 25-year-old client diagnosed with chronic schizophrenia states, "I stopped my medications a week ago. I was just tired of not being able to drink with my friends. Besides, I feel fine without them." Which of the following responses by the nurse is most appropriate? 1. It's important for you to go back on your medicines. 2. I hear how difficult it must be to live with the changes caused by your illness. 3. You will have a talk to your doctor about stopping your medications. 4. Your buddies will understand that you can't drink anymore. The correct answer is 2. By acknowledging the difficulties of living with the illness, the nurse conveys empathy for the client's feelings and opens up the lines of communication. Although it is important for the client to maintain compliance with medication therapy, telling the client that it is important to start taking them again or to talk with the doctor about stopping the medications ignores the underlying feelings of the client's initial statements. Stating that the client's buddies will understand may or may not be true. Additionally, this statement ignores the underlying feelings. The mother of a client with chronic undifferentiated schizophrenia calls the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone in 10 days. She was doing so well for months. "I don't know what's wrong. I'm worried." Which of the following responses by the nurse is most appropriate? 1. Maybe she's just mad at you. Did you have an argument? 2. She may have stopped taking her medications. I'll check on her. 3. Don't worry about this. It happens sometimes. 4. Go over to her apartment and see what's going on. The correct answer is 2. Non-compliance with medications is common in the client with CUS. The nurse has the responsibility to assess this situation, asking the mother if they've argued or if the client is mad at the mother, or telling the mother to go over to the apartment and see what's going on, places the blame and responsibility on the mother and therefore is inappropriate. Telling the mother not to worry ignores the seriousness of the client's symptoms. Which action by the nurse is likely to increase the anxiety and suspiciousness of a client who is delusional? 1. Informing the client of schedule changes. 2. Whispering with others where the client can observe. 3. Telling the client gently that the nurse does not share the client's view. 4. Inviting the client to join in leisure activities. The correct answer is 2. Whispering and laughing with another person where the client can see or observe a nurse, but not hear the conversation, increases the client's anxiety and suspiciousness. Therefore, this action should be avoided. Informing the client of schedule changes. Telling the client gently that the nurse does not share the client's interpretation of an event, and inviting the client to participate in leisure activities help the client to decrease anxiety and suspiciousness and a focus on actual or realistic events. The nurse and the nursing assistant are caring for clients in a birthing center. Which of the following tasks should the nurse delegate to the nursing assistant? Select all that apply. 1. Removing a Foley catheter from a preeclamptic client. 2. Assisting an active labor client with breathing and relaxation. 3. Ambulating a post-cesarean client to the bathroom. 4. Calculating hourly IV totals for a preterm labor client. 5. Intake and output catheterization for culture and sensitivity. 6. Calling a report of normal findings to the healthcare provider. The correct answers are 2 and 3. The nursing assistant could assist the client with breathing and relaxation and ambulate the post-cesarean client to the bathroom. Removing a Foley catheter would also involve assessment of bladder status and totaling the intake and output and would be a nursing responsibility. Calculating the hourly IV totals for a preterm labor client would involve assessments that require nursing expertise. In and out catheterization, a sterile procedure, and calling reports to healthcare providers, which requires gathering and analysis of data, are responsibilities of the nurse. When preparing a multigravida client who has undergone evacuation of a hydatidiform mole for discharge, the nurse explains the need for follow-up care. The nurse determines that the client understands the instruction when she says that she is at risk for developing which of the following? 1. Ectopic pregnancy. 2. Choriocarcinoma. 3. Multifetal pregnancies. 4. Infertility. The correct answer is 2. A client who has had a hydatidiform mole removed should have regular checkups to rule out the presence of choriocarcinoma, which may complicate the client's clinical picture. The client's human chorionic gonadotropin levels are monitored for 1 year. During this time, she should be advised not to become pregnant because this would be reflected in rising human chorionic gonadotropin levels. Ectopic or multifetal pregnancy is not associated with hydatidiform mole. Women who have molar pregnancies have fertility rates similar to the general population. The nurse is assisting with conscious sedation for a 6-year-old undergoing a bone marrow biopsy. The nurse's most important responsibility during the procedure is to 1. Administer the topical anesthetic. 2. Keep the parents informed. 3. Monitor the client. 4. Record the procedure. The correct answer is 3. During conscious sedation, the client may lose protective reflexes, and adequate respiratory and cardiac function may be impaired. At every procedure, there must be one healthcare professional whose sole responsibility is to monitor the client. Topical agents must be given in advance of the procedure to be effective. During the procedure, the nurse would not leave the child to speak with parents. While the procedure will be documented according to the facility's protocols, proper monitoring of the client is the intervention most associated with reducing risks. Which of the following beverages should the nurse plan to give a child with leukemia to relieve nausea? 1. Orange juice. 2. Weak tea. 3. Plain water. 4. A carbonated beverage. The correct answer is 4. Carbonated beverages ordinarily are the best tolerated when a child feels nauseated. Many children find cola drinks especially easy to tolerate, but non-cola beverages are also recommended. Orange juice usually is not tolerated well because of its high acid content. Tea may also be too acidic, and many children do not like tea. Water does not relieve nausea. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following complications? 1. Emboli formation. 2. Fluid volume overload. 3. Red blood cell hemolysis. 4. Allergic reaction. The correct answer is 2. Too rapid infusion of blood or any intravenous fluid can cause fluid volume overload and related problems such as pulmonary edema. Emboli formation, red blood cell hemolysis, and allergic reaction are not related to rapid infusion. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking, so nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer, but cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. The director of a workshop program tells a nurse that the client with schizophrenia had done well for 6 months until last week when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange for the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, the ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait. Asking another staff member to stay with the client, or saying nothing is not helpful. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn, The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important. 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage, because a surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present. An infant has been transferred from the ICU to the pediatric floor after undergoing surgery to correct a heart defect. Which tasks can the charge nurse delegate to the licensed practical nurse? Select all that apply. 1. Administering oral medications. 2. Administering IV morphine. 3. Obtaining vital signs. 4. Morning hygiene. 5. Circulation checks. 6. Discharge teaching. The correct answers are 1, 3, and 4. The RN scope of practice includes assessment, planning, implementing, and evaluation. Only aspects of care implementation may be delegated to the LPN, and the exact skills that may be delegated vary by state and institution. In general, LPNs have been trained to perform the tasks of administering oral medications, performing hygiene, and recording the intake and output. LPNs may also take vital signs to gather data, but the RN must interpret the data. Administering IV morphine requires assessment of the client's respiratory status before, during, and after procedure. It should be done by the RN. Circulation checks are assessments the RN should complete. Which of the following statements should the nurse use to describe to the parents why their child with leukemia is at risk for infections? 1. Play activities are too strenuous. 2. Vitamin C intake is reduced over a period of time. 3. The number of red blood cells is inadequate for carrying oxygen. 4. Immature white blood cells are incapable of handling an infectious process. The correct answer is 4. In leukemia, the number of normal white blood cells that are capable of fighting an infection is decreased. Although there is an increased number of immature white blood cells, they are unable to combat infection. Therefore, a child with leukemia is subject to infection. The major morbidity and mortality factor associated with leukemia is infection resulting from the presence of granulocytopenia. While increased activity may cause fatigue, it does not put the child at risk for infection. Vitamin C intake should not decrease if the child has adequate dietary intake. Decreased red blood cells are not directly caused by infection. A client undergoes surgery to repair lung injuries. Postoperative prescriptions include the transfusion of 1 unit of packed red blood cells at a rate of 60 milliliters per hour. How long will this transfusion take to infuse? 1. 2 hours. 2. 4 hours. 3. 6 hours. 4. 8 hours. The correct answer is 2. 1 unit of packed red blood cells is about 250 milliliters. If the blood is delivered at a rate of 60 milliliters per hour, it will take about 4 hours to infuse the entire unit. The transfusion of a single unit of packed red blood cells should not exceed 4 hours to prevent the growth of bacteria and minimize the risk of septicemia. A client who underwent a lobectomy and has a water-sealed chest drainage system is breathing with a little more effort and at a faster rate than 1 hour ago. The client's pulse rate is also increased. The nurse should 1. Check the tubing to ensure that the client is not lying on it or kinking it. 2. Increase the suction. 3. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. 4. Ensure that the chest tube has 2 clamps on it to prevent air leaks. The correct answer is 1. In this case, there may be some obstruction to the flow of air and fluid out of the pleural space, causing air and fluid to collect and build up pressure. This prevents the remaining lung from re-expanding and can cause a mediastinal shift to the opposite side. The nurse's first response is to assess the tubing for kinks or obstruction. Increasing the suction is not done without a physician's prescription. The normal position of the drainage bottles is 2 to 3 feet below chest level. Clamping the tubes obstruct the flow of air and fluid out of the pleural space and should not be done. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. The support available to assist the client at home. 2. The distance the client lives from a hospital. 3. The client's ability to do home blood pressure monitoring. 4. The client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Non-compliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. What is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks? 1. Calling the client's mother once a day. 2. Attending day therapy 3 times a week. 3. Allowing 2 friends a visit every day. 4. Remaining out of bed for 10 hours a day. The correct answer is 2. Attending day therapy 3 times per week is a long-term goal that will show the most progress in overcoming withdrawal. The client's calling his mother is a first step in getting out of severe withdrawal. Allowing 2 friends to visit every day will be appropriate if the client is successful with calling his mother once a day. Insufficient information is presented in the scenario to indicate that excessive sleep is a problem. The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner. while adding that the medicine also will help, clearly and directly states the need for medication, stating, God helps those who help themselves, challenges a client, stating, God wants you to take your medicine is deceitful, stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious. A woman who is Rh negative has given birth to an Rh positive infant. The nurse explains to the client that she will receive Rogum. The nurse determines that the client understands the purpose of Rogum when she states, 1. Rogum will protect my next baby if it is Rh negative. 2. Rogum will prevent antibody formation in my blood. 3. Rogum will be given to prevent German measles. 4. Rogum will be used to prevent bleeding in my newborn. The correct answer is 2. Rogum is given to new mothers who are Rh negative and not previously sensitized and who have given birth to an Rh positive infant. Rogum must be given within 72 hours of the birth of the infant because antibody formation begins at that time. The vaccine is used only when a mother has born an Rh positive infant, not an Rh negative infant. Rogum does not prevent German measles and is not given to a newborn. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following? 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies. A transfusion of packed red blood cells has been prescribed for a 1-year-old with sickle cell anemia. The infant has a 25-gauge IV infusing dextrose with sodium and potassium. Using the situation, background, assessment, recommendation method of communication, the nurse contacts the primary healthcare provider and recommends: 1. Starting a second IV with a 22-gauge catheter to infuse normal saline with the blood. 2. Using the existing IV, but changing the fluids to normal saline for the transfusion. 3. Replacing the IV with a 22-gauge catheter to infuse the prescribed fluids. 4. Starting a second IV with a 25-gauge catheter to infuse normal saline with the transfusion. The correct answer is 2. The best evidence indicates that a catheter as small as 27 gauge may safely be used for transfusion in children, but blood must be infused with normal saline, not dextrose. A 1-year-old should be able to maintain their blood glucose for the 2-hour duration of the infusion without the need for a second IV. Which of the following is the highest risk for a child with leukemia whose lab values are as follows: WBC 6,500, platelet count 40,000 microliter, and HCT 41.2%. 1. Activity intolerance. 2. Bleeding. 3. Impaired tissue perfusion. 4. Infection. The correct answer is 2. A normal platelet count is 150,000 to 400,000 microliter. A platelet count of 40,000 microliter is low and puts the child at risk for injury, bruising, and bleeding. Hematocrit of 41.2% is normal. Therefore, the child will have adequate oxygenation and tissue perfusion. 6,500 is a normal white count. Therefore, the child has no increase in risk for infection. For a client with rib fractures and a pneumothorax, the physician prescribes morphine sulfate, 1 to 2 milligrams per hour, Given IV is needed for pain, the nursing care goal is to provide adequate pain control so that the client can breathe effectively. Which of the following outcomes would indicate successful achievement of this goal? 1. Pain rating of 0 on a scale of 0 to 10 by the client. 2. Decreased client anxiety. 3. Respiratory rate of 26 breaths per minute. 4. PaO2 of 70. The correct answer is 1. If the client reports no pain, then the objective of adequate pain relief has been met. Decreased anxiety is not related only to pain control. It could also be related to other factors. A respiratory rate of 26 breaths per minute is not within normal limits, nor is the PaO2 of 70, but these values are not measures of pain relief. The nurse observes a constant gentle bubbling in the water seal column of a water seal chest drainage system. The nurse should 1. Continue monitoring as usual. This is expected. 2. Check the connectors between the chest and drainage tubes and where the drainage tube enters the collection bottle. 3. Decrease the suction to negative 15 centimeters H2O and continue observing the system for changes in bubbling during the next several hours. 4. Drain half of the water from the water seal chamber. The correct answer is 2. There should never be constant bubbling in the water seal bottle. Normally, the bubbling is intermittent. Constant bubbling in the water seal bottle indicates an air leak, which means that less negative pressure is being exerted on the pleural space. Decreasing the suction or draining part of the water in the water seal chamber will not reduce the leak. A client who underwent a left lower lobectomy has been out of surgery for 48 hours. The client is receiving morphine sulfate via a patient-controlled analgesia system and reports having pain in the left thorax that worsens when coughing. The nurse should 1. Let the client rest so that the client is not stimulated to cough. 2. Encourage the client to take deep breaths to help control the pain. 3. Check that the PCA device is functioning properly, and then reassure the client that the machine is working and will relieve the pain. 4. Obtain a more detailed assessment of the client's pain using a pain scale. The correct answer is 4. Systematic pain assessment is necessary for adequate pain management in the postoperative client. Guidelines from a variety of healthcare agencies and nursing groups recommend that institutions adopt a pain assessment scale to assist in facilitating pain management. Even though the client is receiving morphine sulfate by PCA, assessment is needed if she is experiencing pain. The concern is not to eliminate coughing, but to control pain adequately. Coughing is necessary to prevent postoperative atelectasis and pneumonia. Breathing exercises may help control pain in some circumstances. However, most clients with thoracic surgery require parenteral opioid analgesics in the early postoperative period. Although it is necessary that the PCA device be checked periodically to ensure that it is functioning properly, if the machine is functional and the client's pain is not relieved, further intervention, beginning with a pain assessment, is indicated. A nurse working at an outpatient mental health center, primarily with chronically mentally ill clients, receives a telephone call from a mother of a client who lives at home. The mother reports that the client has not been taking her medication and now is refusing to go to the sheltered workshop where she has worked for the past year. What should the nurse do first? 1. Call the director of the workshop for information about the client. 2. Reserve an inpatient bed in preparation for the client's admission. 3. Ask to speak to the client directly on the phone. 4. Make an appointment for the client to see the doctor. The correct answer is 3. The first thing that the nurse should do is to speak with the client on the phone and question her about perceptions or reasons that are interfering with her going to the sheltered workshop. This conveys that the nurse is interested and willing to help the client. The nurse should call the director of the workshop for information only if the nurse receives the client's permission. Making preparations for the client's admission is inappropriate and would not be done until the client's needs have been assessed and it is determined that the client requires hospitalization. Making an appointment with the doctor is inappropriate until the nurse has assessed the client's needs. The nurse notes that a client sitting in a chair has not gotten up in 1 hour. The client does not respond to verbal directions, and her arm has been extended over the armrest for 30 minutes. Which of the following should the nurse do next? 1. Assist the client out of the chair to lead her back to bed. 2. Give PRN prescribed doses of haloperidol, Haldol, and lorazepam. 3. Ask the client to describe what she is experiencing right now. 4. Sit quietly with the client until she begins to respond. The correct answer is 2. The client is exhibiting catatonic behavior, an acutely serious result of severe anxiety and psychosis. In this situation, the nurse needs to administer the PRN prescribed doses of haloperidol and lorazepam. They can be given together safely. Assisting the client out of the chair go back to bed, or sitting quietly until the client responds ignores the seriousness of the client's condition. It is unlikely that the client can describe what is being experienced. A client with schizophrenia comes to the outpatient mental health clinic 5 days after being discharged from the hospital. The client was given a 1-week supply of clozapine. The client tells the nurse that she has too much saliva and frequently needs to spit. The nurse interprets the client's statement as indicating which of the following? 1. Delusion, requiring further assessment. 2. Unusual reaction to clozapine. 3. Expected adverse effect of clozapine. 4. Unresolved symptom of schizophrenia. The correct answer is 3. Sialorrhea, excessive salivation, is commonly associated with clozapine therapy. The client can use a washcloth to wipe the saliva instead of spitting. It is an expected adverse effect of the drug, not a delusion, an unusual reaction, or an unresolved symptom of schizophrenia. A woman who has given birth to a healthy neonate is being discharged. As part of discharge teaching, the nurse should instruct the client to observe vaginal discharge for a postpartum hemorrhage and notify the healthcare provider about 1. Bleeding that becomes lighter each day. 2. Clots the size of golf balls. 3. Saturating a pad in an hour. 4. Lochia that lasts longer than 1 week. The correct answer is 3. A postpartum client who saturates a pad in an hour or less at any time in the postpartum period is considered to be hemorrhaging. As the normal postpartum client heals, bleeding changes from red to pink to off-white. It also decreases in amount each day. Passing blood clots the size of a fist or larger is a reportable problem. Lochia varies in how long it lasts and is considered normal up to 6 weeks postpartum. A client at 15 weeks gestation is admitted with dark brown vaginal bleeding and continuous nausea and vomiting. Her blood pressure is 142/98 and fundal height is 19 centimeters. The nurse should prepare to do which of the following? 1. Transfer the client to the antenatal unit. 2. Keep the client NPO for 24 hours. 3. Administer magnesium sulfate. 4. Obtain an ultrasound. The correct answer is 4. The nurse should prepare the client for an ultrasound to determine the cause of the symptoms. Elevated blood pressure at this point in the pregnancy could indicate chronic hypertension, as well as hydatidiform mole. The fundal height of 19 centimeters is higher than is typically found at 15 weeks gestation and is indicative of a molar pregnancy. The dark brown vaginal bleeding in isolation could indicate an abortion, but when placed in context of the other symptoms, is likely related to a hydatidiform mole. The continuous nausea and vomiting is abnormal at this point in the pregnancy and can be a result of high levels of progesterone from a molar pregnancy. There is no fetus involved. The blood pressure elevation and continuous nausea and vomiting will resolve with evacuation of the mole, negating the need for magnesium sulfate therapy and placing the client on NPO status. A nurse is teaching the family of an 8-year-old boy with acute lymphocytic leukemia about appropriate activities. Which of the following activities should the nurse recommend? 1. Homeschooling. 2. Restriction from participating in athletic activities. 3. Avoiding trips to the shopping mall. 4. Being treated as normal as much as possible. The correct answer is 4. Any child with a chronic illness should be treated as normally as possible. Unless the child has severe bone marrow depression, he should be allowed to go to school with others and can go to the mall. If the child is in remission, athletic activities are allowed. After teaching the parents of a child newly diagnosed with leukemia about the disease, which of the following descriptions given by the mother best indicates that she understands the nature of leukemia? 1. The disease is an infection resulting in increased white blood cell production. 2. The disease is a type of cancer characterized by an increase in immature white blood cells. 3. The disease is an inflammation associated with enlargement of the lymph nodes. 4. The disease is an allergic disorder involving increased circulating antibodies in the blood. The correct answer is 2. Leukemia is a neoplastic or cancerous disorder of blood-forming tissues that is characterized by a proliferation of immature white blood cells. Leukemia is not an infection, inflammation, or allergic disorder. Which of the following findings would suggest pneumothorax in a trauma victim? 1. Pronounced crackles. 2. Inspiratory wheezing. 3. Dullness on percussion. 4. Absent breath sounds. The correct answer is 4. Pneumothorax means that the lung has collapsed and is not functioning. The nurse will hear no sounds of air movement on auscultation. Movement of air through mucus produces crackles. Wheezing occurs when airways become obstructed. Dullness on percussion indicates increased density of lung tissue, usually caused by accumulation of fluid. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative intrapleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, intrapleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be, 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1. Teaching independent living skills. 2. Assisting clients with living arrangements. 3. Helping clients in insight-oriented therapy. 4. Linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources. A client with chronic undifferentiated schizophrenia reports doing very little all day except sleeping and eating. The nurse should 1. Have 3 meals per day brought in to increase the amount of time the client spends out of bed. 2. Ask a relative to call the client at least 10 times a day to decrease the sleeping. 3. Help the client set up a daily activity schedule to include setting a wake-up alarm. 4. Arrange for the client to move to a group home with structured activities. The correct answer is 3. The client with CUS needs more structure every day to improve functioning. Therefore, helping the client to set up a daily activity schedule is most appropriate. However, a group home is not necessary. The client is already eating. Having meals brought in would increase the client's dependence, not his activity level. Asking a relative to call the client 10 times per day is unrealistic given the typical daily responsibilities of a healthy relative. A 77-year-old client is brought to the emergency department by her son. The client has severe headache and lack of sleep because I'm so worried about everything. Her son says that she has heart failure and chronic schizophrenia. In addition to all of her heart medicines, she is on aripiprazole, which was increased to 30 milligrams by her family doctor 3 days ago. In addition to documenting all the client's medications and exact dosages, the nurse should particularly investigate which of the following? Select all that apply. 1. The qualifications of the client's primary care provider. 2. The client's symptoms of schizophrenia. 3. The dose of aripiprazole. 4. The client's symptoms of heart failure. 5. The client's relationship with her son. The correct answers are 2, 3, 4. The client's symptoms are likely to be adverse effect of aripiprazole, especially at the reported dose. The normal adult dose is 5 to 10 milligrams. The elderly client commonly needs a lower dose compared with other adults. The anxiety and sleep disturbance could be symptoms of schizophrenia or medication adverse effects. A holistic approach would include assessing the client's heart failure. Questioning the qualifications of the family doctor is unproductive. There are no indications of problems in the client's relationship with her son. A client has just had a cesarean section for a prolapsed cord. In reviewing the client's history, which of the following factors places a client at risk for cord prolapse? Select all that apply. 1, -2 station. 2, low birth weight infant. 3, rupture of membranes. 4, breech presentation. 5, prior abortion. 6, low-lying placenta. The correct answers are 1, 2, 3, and 4. Having the fetus at a negative station places the client at risk for a cord prolapse. With a negative station, there is room between the fetal head and the maternal pelvis for the cord to slip through. A small infant is more mobile within the uterus, and the cord can rest between the fetus and the inside of the uterus or below the fetal head. With a large infant, the head is usually in a vertex presentation and includes the lower portion of the uterus, preventing the cord from slipping by. When membranes rupture, the cord can be swept through with the amniotic fluid. In a breech presentation, the fetal head is in the fundus and smaller portions of the fetus settle into the lower portion of the uterus, allowing the cord to lie beside the fetus. Prior abortion and a low-lying placenta have no correlation to cord prolapse. The primary healthcare provider prescribes 1,000 milliliters of Ringer's lactate intravenously over an 8-hour period for a 29-year-old prima gravida client at 16 weeks gestation with hyperemesis. The drip factor is 12 drops per milliliter. The nurse should administer the IV infusion at how many drops per minute? Blank drops per minute. The correct answer is 25 drops per minute. The formula is set up as 12 drops over 1 milliliter times 1,000 milliliter over 8 hours times 1 hour over 60 minutes. You multiply everything and you get 12,000 over 480. You divide 12,000 by 480 and you get 25 drops per minute. A 10-year-old with leukemia is taking immunosuppressive drugs. To maintain health, the nurse should instruct the child and parents to 1. Continue with immunizations. 2. Not receive any live attenuated vaccines. 3. Receive vitamin and mineral supplements. 4. Stay away from peers. The correct answer is 2. Children who are immunosuppressed should not receive any live attenuated vaccines. Clients who are immunosuppressed and are given live attenuated vaccines, such as measles, mumps, rubella, and oral polio vaccine, can develop severe forms of diseases for which they're being immunized, which can result in death. Inactivated vaccines may be given if necessary, but the client is not able to adequately produce needed antibodies, and it is recommended that immunizations be delayed for 3 months after the immunosuppressive drugs have been discontinued. Vitamin and mineral supplements are not normally given in conjunction with immunosuppressive drugs. When the client is immunosuppressed, the client should avoid only persons who have an infection. A 12-year-old with leukemia is receiving cyclophosphamide. The nurse should assess for the adverse effect of 1. Photosensitivity, 2. Ataxia, 3. Cystitis, 4. Cardiac arrhythmias. The correct answer is 3. Cystitis is a potential adverse effect of cyclophosphamide. The client should be monitored for pain on urination. Photosensitivity, ataxia, and cardiac arrhythmias are not adverse effects associated with cyclophosphamide. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. When caring for a client with a chest tube and water-sealed drainage system, the nurse should 1. Verify that the air vent on the water-sealed drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative intrapleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb 1 flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which of the following: 1. Apathy, affect, social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first: 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on the cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. Estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. A 12-year-old with leukemia will be taking vincristine. The nurse should encourage the child to eat what kind of diet? 1. High residue. 2. Low residue. 3. Low fat. 4. High calorie. The correct answer is 1. Vincristine may cause constipation, so the client should be encouraged to eat a high residue diet. The other diets do not help with constipation that can occur while receiving vincristine. A 15-year-old has been admitted to the hospital with a diagnosis of acute lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing intervention? 1. Fatigue and anorexia. 2. Fever and petechiae. 3. Swollen neck lymph glands and lethargy. 4. Enlarged liver and spleen. The correct answer is 2. Fever and petechiae associated with acute lymphocytic leukemia indicate a suppression of normal white blood cells and thrombocytes by the bone marrow and put the client at risk for other infections and bleeding. The nurse should initiate infection control and safety precautions to reduce these risks. Fatigue is a common symptom of leukemia due to red blood cell suppression. Although the client should be told about the need for rest and meal planning, such teaching is not the priority intervention. Swollen glands and lethargy may be uncomfortable, but they do not require immediate intervention. An enlarged liver and spleen do require safety precautions that prevent injury to the abdomen. However, these precautions are not the priority. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water-sealed chest tube drainage system. The nurse notes that the fluid in the water-seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water-seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water-seal column. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.